We are the two people. I am Christian Rapin, the sales manager for Arterys Europe, and Giorgio is a marketing and communication manager for Europe. And very quickly, just to take you to an overview into Arterys, we are not a startup anymore. Now we are a scale-up. We are based in San Francisco. We have the headquarters in San Francisco, development team in Canada, marketing and product management team in Paris, Europe. So we are very happy to bring strengths from Europe for an American company. And we are proposing different artificial intelligence products over the European market. And we are for sure CE marked. We are 100% compliant with GDPR. And we already have some very important customer. This is the next slide, Giorgio, where you see we have both academic with all the UC, San Francisco, Los Angeles, San Diego in the US, the Mayo Clinic. And we have in Europe a lot of very prestigious hospitals like the Paris Hospital, we have Zurich Hospital in Switzerland, we have Heart Center in Czech Republic, in Romania, we have the King's College in London, we have a lot of customers in Italy like Fondazione Meyer. So all those customers help us to develop our product and they provide very positive feedback on it. We all noticed and we all found that the workload of radiologists has increased by 50% over the last decade, and the number of radiologists fall down by 50%. And we know that they are all concerned with burnout. So we try to put artificial intelligence in such a way that it's not even in the mind of the people gonna replace the radiologist, but it's just a new weapon, a new tool, a new support, a second pair of eyes for them, just to provide new diagnosis support. If we go to next slide. And what we are providing today is really advanced with artificial intelligence solution to help the radiologist take the best of the images. We go very far in cardiac imaging because we know there is a boom in cardiac imaging in Europe. There is more and more procedure. This morning I got some message from Sweden asking for those tools. And so we want to provide better examination. Without our system, without AI, a cardiac examination can be wrong because we don't look at correctly at the whole heart in all the different angles we can provide with artificial intelligence. We are providing lung imaging for cardiac CT, also for lung CT. We are detecting nodule and not only detecting, we are doing the follow-up of the nodules. We are providing also diagnosis for bones, where we are detecting all the lesion, all the fracture for the whole body. And at the same time, we are looking at the thorax. We are detecting the fractures in the ribs. And also we are detecting if there is any opacity like COVID-19, or if there is a pneumothorax or any disease in the thorax. And the idea is that when you use the artificial intelligence for one thing, artificial intelligence can look at something else. So you never miss anything. And then we are doing the same thing for neuro, where we cover the whole area of neurology from tumor follow-up, the traumatology with the stroke detection, very early detection, because for stroke, every minute counts. And also we are doing multiple sclerosis and volumetry for neurodegenerative disease tracking. And everything is available in one place. And the last one is mammography. We are doing 2D and 3D, and we are doing also a risk scoring. And this is the ability to provide to the lady, saying that there is a risk over the next coming 2 years, even if the doctors and the AI don't detect a real lesion, there might be a risk. So we need to do more exam in the interval between the two examinations for the breast screening. So this platform is quite complete, and this allows the customer to maybe purchase one AI model, and then they can try another one, they can implement one, and then they can go one by one. So the magic, next slide, Giorgio, the magic of this platform is that everything is CE marked, approved, compliant with GDPR. The cloud is located in Frankfurt, Germany, so no worries for European people. And it can be, the examination are accessible anytime from everywhere because it's cloud. So when it's a group of hospital, when it's a group of radiologists, they can share the examination, they can do whatever they want. And we have developed a lot of patents to compress the image, keeping a great level of quality for the image. You can go back, Giorgio. Keeping a great level for those image and the great level of quality. So this allows speed. So there is no more trouble with cloud where you have to wait 50 minutes to get your image. Now it comes back to your PACS in 2 minutes. And we are really simplifying the workflow for the customer. So this can be very accessible, very easy to launch a collaborative work, and very easy to take the best of the cloud and the best of the security, because everything is stored in Amazon AWS in Frankfurt. So there is quite really no risk of hacking for this, and everything is encrypted and protected. So this is very good. I can give you quickly in the 2-3 minutes that remain 2 examples where we see the real benefits of neuro AI. So next slide, please, Giorgio. This thing is a real case. A 39-year-old man arriving at the emergency department at night. So where we see the value of AI is always at night, during the weekend, during the shift of the doctors. And this is typical from emergency department. They detect and they diagnose fracture on the occipital, on the head of the patient, and they let him go. But in the morning, the guy came back with trouble because they missed the hemorrhage. And what we can do with a tool like Arterys is that we can have another eyes looking at the images and sending automatic SMS or text message. This is the animation you see on the right piece of the screen. And then we send those information directly to the doctors. So everybody get notification in real time. And you have this second pair of eyes with AI that help you do very advanced detection. And if we go to next slide, we got some, we have some other example where in case you are in an emergency department, in case of you see, there is a simple fracture in the middle. But what we don't see is the other fracture, the second one, which is not easy to see. So the idea of AI is when you have the focus on something, then AI can take the time to look at the whole exam to make sure there is not any other trouble happening somewhere. And if I have 1 more minute, so if we can go to the next for cardiac imaging, and I can provide some, this one is very interesting, because when we think of cardiac imaging, in case of congenital disease, the shape of the heart is different from the standard one. So this is where AI and an advanced system like Arterys can really help you look into the heart in every angle, any plan, any direction, where you can do your diagnosis on aortic disease, valvular disease, or any shunt. The system is helping you in real time. If you go to the slide above, Giorgio, where we see the animation, the system can show you the speed of the blood into the heart. We can calculate this speed, and we can calculate everything around the heart. So as a conclusion, you can go to the last slide, Giorgio. As a conclusion, I will just say that that Arterys is really dedicated to help the radiology department and also the emergency department in any hospital, and it's really flexible and scalable and fitted to help everybody. And you have the list of the arguments here, and I'm open for questions.
Thank you much, Christian. It was fascinating to see, absolutely. So the floor is yours, guys, for questions. I have some multiple questions, but I will let you go first.
Václav here. Hello, Christian, Giorgio. Beautiful technology, very nice presentation. Thanks a lot. I just wanted to ask quickly, at the beginning you were presenting about partners or the associated centers You mentioned you had a partner or associate in Czech Republic already?
Yes, in Czech Republic, we are looking for a partnership with ICEM, which is a big center, and
Right.
they will start evaluating our solution in September this year.
Okay.
And the biggest we have is in Nuš, which is in Slovak Republic.
Yeah, know that. Okay, very good. Thanks a lot. Christoph, I'll ask you then for contact with Christian after.
Okay.
Thanks.
And we are looking for partner in Europe, and we are looking for actively for distribution, because we have some countries where the radiologist and the hospital manager, they don't know us, and they are all looking for a platform where they have one person to speak to deploy AI in the hospital. They don't want to go direct to all the AI models that are evolving.
Mm-hmm. Perfect, thank you. I will share the contact with you and Václav later on. I want to ask you with regards to the AI. I know it's a booming sector and booming and buzzword, you know, all around the world now. Yeah. So maybe, you know, digging deep into the acceptance and the perception of AI, you know, the context of the question is, I would say that, for example, like in Eastern Europe, the adoption of AI is rather conservative, to put it politely. And, you know, so how do you actually persuade the doctors and the practitioners to, you know, to switch to AI? And maybe a follow-up question, actually, with regards to the screening you presented earlier with the fracture. Is it a common issue that, for example, like even like the super experts in the field miss like a small fracture because you know, they can't see visibly the whole picture, for example?
Yeah, so thank you for this question. What we are thinking of is for fracture detection. The example is really the emergency department, where the doctors, they are mostly not trained on fracture detection. And most of the time they miss every time it's complex, or when it is on the extremities, on the hand, on the feet. And because they are not trained, they are looking for a second pair of eyes. And we recently achieved a study where we are showing that the difference of diagnosis between emergency department and radiology department can be reduced by 90% if they use AI. So when they are doing mistakes in the emergency department, then the patient, they have to come back to the emergency department. Then if there is a trouble, then there will be a litigation. So the hospital might be sued because of this. So that's where we see the value. But today it's true that a senior radiologist, AI is not better than him. But when he's tired or when he's not there, then AI can be a very strong interest. So that's why we see a great move in Western Europe in the emergency department. But in Eastern Europe, we see a real strong request for tools like cardiac imaging, lung imaging. We have a lot of customers doing this in Greece. And I told you we are started in Poland. We have 3 sites in Poland for cardiac imaging. And there is this request. They want advanced diagnosis support. So as a summary, I will tell you, until now, AI is really in the head of the people, but not in their pocket, because they are not ready to purchase that easy. But when you have a good agreement saying that you can start with a pay-per-use, and they can send a few examinations to AI, so they will pay a low cost just to get the first glimpse of what the benefits of AI can be. So in that case, this is very flexible, and they know they can start small, and then after they can think bigger. And AI can really support second pair of eyes, supporting the doctors that are not trained. And sometimes they are missing, like for hemorrhage or stroke, they are doing the wrong diagnosis, or sometimes it takes too much time. And in that case, it's too late for a surgery. And they are not only missing the life of the patient because they bring the diagnosis too late, but also they are missing a surgery. And in case they miss a surgery, they will miss the reimbursement. So getting faster with AI can also be a way to make more money for the hospital. So there is always a return on investment that is quite simple to demonstrate. And for sure, for any case, we will be ready to support any one of you that want to go in this direction.
Christian, a quick question, please. Assuming an emergency or a radiology department are convinced to give it a try, how easy or difficult is the process of training and implementing such a service initially?
Yeah.
Are we just talking software basically and training? What does it encompass?
Training is really easy because the way we design our software is that they can use it with only 1 hour of training. So it's getting very fast. It can be done remotely. We have a team of clinical specialists to do it. And what is very important with Arterys is that we have designers that have designed the software so that it's very easy to use. So the ease of use is number one. So there is absolutely no trouble or no bad feedback from doctors using the software so far. So I'm very happy with this, and this is the easiest piece for me. The most complex piece is on the IT part, because we need to send the image to the cloud, to Arterys Cloud in Frankfurt. And for this, we need to remove the patient data. So we need to do anonymization. So for this, we need to install a small piece of software on site that is stripping the examination from the patient data. This installation takes 30 minutes. And sometimes it can take 2 or 3 months to get the good IT guy available. So it's very important. I saw it this morning with an example in Greece, where we focus on a site where we know the IT guy. We did the installation in less than 1 hour. We call the guy, he said, oh, I have 30 minutes, let's do it, 30 minutes. We create a virtual machine, we install Arterys software, and everything was fine. 1 minute to connect the MRI or the CT scanner. But the most difficult piece, to be honest with you, is to get this IT guy that will create this virtual machine to host this very small server that is just stripping the data, because this is the only piece of software we need to install locally. And this is the only difficulty we have.
Right. Thank you. Thanks.
For training, really nothing. Look at the screenshot on the website, arterys.com. You will see it's always easy. You have the examination on the left, or the action button on the right. Very, very simple. Everybody loves it.
And just my last question, please, Christian. If you had to tackle for the first time, promote this technology, which department would you tackle first? Are we talking emergency suites here, or radiology? Which would be the easier one to start with?
The easier one is really emergency. They really need it for stroke, and they need it for fracture detection. But the only trouble with emergency is sometimes they are not responsible for their budget. So they want it, but they don't know how to pay it. So that's where you have to go to radiology. And radiology, they say, why will I pay for emergency? And so it's always a chicken and the egg, but really for me, 100% emergency. You go direct, and there is a huge room for this in every European country.
Thank you.
Just as hi Christian, as a follow-up to Betty's question, therefore, and to your answer on emergency. So if it is on a pay-per-use basis, how fast is your reaction time when there's an emergency case? How does it work on a pay-per-use, or do you not use pay-per-use for emergency?
Pay-per-use, they pay afterwards. So they pay when the quarter is over, or they pay after. So they have a subscription to Arterys, which is open, and they pay what they use after. So when there is an emergency, the examination is sent automatically to Arterys. So there can be automation on the CT scanner that is pushing all the emergency stroke examination to Arterys.
So the automation is installed in the same way. It's just an issue of the payment method when you talk about this introduction of pay-per-use.
Yeah, completely. And what we can do, we can have a special pricing where we say to the user that we will just charge the examination that are positive, or we will just charge the examination that they open, that they give a look or they open in their packs. So we can have very different mechanism. Everything can be flexible for this. Or it can be an annual subscription. You can estimate the number of exams they are providing from emergency department. And then we say, okay, so this is the estimate, and we have an average selling price for by exam, and we give you a price for the year. And
Thank you.
We can be creative on this.
Perfect. Thank you all. Thank you, Jonathan, for the questions as well. Thank you, Christian, for the explanation. One more remark. I know that we are now out of time, but if somebody has some more questions, definitely post it in the chat, or send it to me, or perhaps ask it now. You can have a break, but I think we have many questions actually still. So if you want to guys follow up with some more questions, now's the time to go as well. In that case, I would also just ask you, Christian, one last question from my side. Is your business model based on subscription then, if I understand it correctly?
Yes, this is on subscription. They need at least a subscription for 3 months or a number of exams during a year.
Right. And with regards to the acceptance, like you said, so you propose like gradually to the experts to adopt and implement your product. So is there some, they don't have to, go immediately on an AI platform, but they can, do it gradually? Is that correct?
Absolutely, yes. Most of them, they are trying many AI model, and then they pick one, they make it working fine, and then they will add the second, and then we can help them create some milestone where they said the first one was successful, we go to the next one, we expect this, we go to the third one. And this is a long time project.